What does Obama's healthcare plan do or not do for Hawaii? For a lot of people in Hawaii who are working for employers less than 20 hours a week and don't have healthcare coverage as a result of that, it means that they will be covered, at least by 2014. And that's because healthcare now is a right, thanks to the healthcare plan. We have some problems that we're going to be facing as a result of the healthcare plan, but that's a good thing, and it's important for us to expand the coverage. Hawaii has, for the longest time, been of the opinion that healthcare is a right, because in 1973 we passed a law requiring employers to provide coverage for their employees. But as you probably know, if you work less than 20 hours for an employer, you don't have a right to coverage. And so the new health plan is going to make sure that folks who are working 2 or 3 jobs and they don't have health coverage now will have health coverage. That's a good thing. Another part of the plan that's positive for Hawaii is Medicare coverage is better assured under the new health care plan. And that's because Medicare was going to run out of money in a few years, and the health plan has ensured that Medicare is going to be available, that Medicare services will be available to everyone. And that's partly because the hospitals chimed in with President Obama and agreed to slash the cost for Medicare because there'll be more coverage for everybody nationwide. So these are some positives that the plan has for us. We have some challenges as a result of this plan, and one of the big things for Hawaii is we don't have enough doctors and we don't have enough nurses. We've got several major hospitals on the island of Oahu, and one of them, as you know, is on the brink of going out of business. We need that hospital facility. The healthcare plan that just passed in Congress isn't going to necessarily provide any support for that. And it doesn't provide enough support for new doctors, new nurses, and for medical education. I'm very concerned about that and have been. Several years back, the legislature actually tried to close our medical school, and fortunately we fought to keep it open. And in these days, when there'll be broader coverage, we absolutely need to educate more doctors and nurses. It's imperative. I could give you some numbers, but we really only educate about 2/3 of the number of doctors that we have residency positions for in the United States right now, and Hawaii doesn't contribute enough in medical education because we have unique elements in medicine in Hawaii that I believe we need to export to the nation. Our perspective on the way of providing health care, which dates back to Hawaii's early days in 1970s when we decided that health care was a right. And there's some attitudes about health care in Hawaii and holistic care that I hope that we can export to the nation, that we can use those ideas to incorporate into preventative health, which is something that we're going to have to do better at implementing if we're going to drive down the cost of healthcare, because healthcare costs are what is really contributing a major part of the deficit and the growing deficit. So we need to focus on preventative health, and Hawaii has a lot to say about that. I hope to make that point and help Hawaii export those ideas.